Hello, and welcome back to Counselor HQ, the place where we keep it real about what it's actually like to work in the counseling field. If you've ever found yourself thinking, should I go into school counseling or clinical mental health counseling? You're absolutely not alone. This is one of the biggest decisions future counselors have to make, and also one of the most confusing. So, today I'm going to break it all down for you. We're going to talk about the differences between the two, the day to day reality between the two, the pros and cons, and how to figure out which path is best for you. I have done both, so I consider myself very knowledgeable about each of these. So let's get into it. All right, so let's look at the big picture difference. At the most basic level, here's the difference. School counseling is all about supporting students within a school system, academically, socially, and emotionally. Clinical mental health counseling is focused on providing therapy to individuals dealing with mental health concerns. So, a simple way to think about it is school counselors work in education systems, clinical counselors work in mental health systems. And that difference shapes everything about what your day looks like. So, let's talk about that work settings, daily life. What is your actual day going to look like as each of these professions? If you're a school counselor, you're working in a school, elementary, middle, high school. Your schedule follows the school calendar, which means yes, summers and holidays are off most of the time, or at least lighter. I did have to work a little bit over the summer. Anyway, but your day, it's fast, it's busy. Sometimes it's very chaotic. You might be running a small group in the morning, responding to a student crisis right before lunch, meeting with parents or teachers, helping a student figure out their schedule, and answering approximately 47 emails in between all of these things that are happening. No 2 days are the same, ever. Okay. If you're a clinical mental health counselor, you could be in a private practice, a community agency, a hospital, or even fully remote, like I am. Your day is typically more structured, but in a different way. Think back to back sessions like 9 a.m. client, 10 a.m. client, 11 a.m. client with notes, treatment planning, maybe a coffee break if you're lucky. And instead of quick check ins, you're doing deeper, ongoing therapeutic work. So the skill set is a little bit different. The skills you use in each role are different. So the school setting skills, you have group facilitation, you have immediate crisis response, you have collaboration with teachers, with families, with administration. You work on organization and time management. And you're working on advocacy within a system that you have very little, if no, control over. You're basically a professional problem solver and a bridge builder. In the clinical mental health setting, your skills look more like deep therapeutic techniques like cognitive behavioral therapy or trauma work. You're diagnosing mental health conditions. You're working on long term treatment planning, and you're holding emotional space for each of your clients. You're more of a healer and a space holder. So let's talk about the career paths and the growth that you might be able to see. Each path can take you into a little different future, I guess. So school counseling, you'll need certification depending on your state, and it can grow into roles like lead counselor or department chair or even administration if you choose to continue your certification further. The perks, you have a predictable schedule. You know when you have to be to work, you know when you're going to go home. You get school breaks off, and you have strong benefits in a lot of school districts. The challenge is you have a high caseloads. The American School Counseling Association recommends 250 students per school counselor. That is a recommendation. It is not mandated in most states. So typically, school counselors have, on average, about 500 students on their caseload. It could be more, it could be less, depending on where you are. There's role confusion, right? You might get asked to do a little bit or a lot of everything. And there's limited time for that deep counseling. You don't do deep therapy when you're in school. Okay? The kids are supposed to be in class. You don't have time. They don't have time for you to do that deep work. Okay? Clinical mental health counseling, you work towards licensure, like an LPC, which is a licensed professional counselor, or an LCPC, which is a licensed clinical professional counselor. Different states have different acronyms and different things, but some of them have like contingency licenses and things like that. I have all of that information on counselorhq.net if you're looking for it. You have a lot of flexibility where you can go. You can open your own private practice. Some states require that you have like a higher, I don't want to say higher, but a different licensure to open your private practice. You can specialize in areas like trauma or anxiety. You can supervise or teach other people that are learning how to be a counselor. The perks, it's flexible. You kind of create your own schedule. You have a little bit of autonomy. You have the ability to really dive deep with your clients. The challenge is emotional burnout is huge. Isolation. You're often working by yourself, and you don't have that like colleague support, that collaboration. Sometimes you do, depending on where you work. You have to work with insurance and billing, and that can be really frustrating sometimes. And your income can be inconsistent at first once, when you first dive into it. Okay, so really the difference here when you are choosing which path to take is your personality. It really depends on what fits for you. There's no right or wrong. It's just what you feel like fits your life better. You might lean towards school counseling if you love working with kids or teens. If you enjoy a variety of different things mixed in with a little bit of chaos. If you like being part of a team. If you want a schedule that aligns with maybe your family life. You might lean towards clinical mental health counseling if you love deep one-on-one conversations, or you want to specialize in something specific, or you value independence and flexibility, and you feel called to that long-term healing work. The honest truth, this is something that I really want you to hear. There is no better choice, only the choice that fits you best. Okay. It fit me to be a school counselor for a very long time, and I loved what I did, but then it didn't fit anymore. And so now being a telehealth therapist at home works for me now. So that is a great point. You're not locked in forever. There are many of us who pivot from schools to private practice, from clinical work to schools, or even doing both at the same time. I know when I was getting my license, I was working at the school during the day and then seeing clients at night. So your career can evolve as you do and as your needs change. So if you're stuck, I want to give you some questions to maybe help you decide. Do you want structure or flexibility? Do you prefer short-term support or long-term therapy? How do you feel about working inside large systems that you often have very little control over the rules? Do you want the option to work for yourself someday? And what kind of burnout feels more manageable for you? Fast-paced overwhelm or emotional intensity? Because both are real, and both settings do provide much opportunity for burnout, which is why you always need to take care of you. At the end of the day, both paths are incredibly meaningful, and I have gotten meaning out of both immensely. You're going to make an impact no matter what you choose. The goal is just to find the path that supports you while you're supporting everyone else. If this video helped you, make sure to like, drop a comment, tell me which path you're leaning towards, and subscribe for more real talk about the counseling field. If you want a super simple side-by-side comparison chart, I'm going to link one in the notes